Welcome to a cardiac exam that can be performed if your patient presents with right-sided heart failure. To begin, we want to start off by performing proper hygiene precautions by washing our hands and anything else we deem necessary. And of course, we want to start off our patient interaction the same way we always do, by confirming their name and date of birth, and following that up by asking if the patient is experiencing any pain currently or if they have any questions for us, making sure they feel as comfortable as possible before we proceed any further. Start off our examination, we're going to be inspecting the hands and upper extremities for signs of further chronic heart failure. We're going to start off with the hands, checking the dorsal and palmar side of the hands, checking for signs of hemorrhaging, smoking, cyanosis, anything that would be concerning. We also want to check bilaterally for temperature to make sure everything is even and there are no signs of infection. Next, we want to check for clubbing of the fingers. And finally, capillary refill time should normally be under 2 seconds. Next, we're going to check the eyes for any signs of abnormalities, such as signs of hyperlipidemia. Now, checking for any further signs of chronic heart disease. Now I am checking the lower extremities for any signs of pitting edema. Checking for sacral edema. And finally, checking for ascites in the abdomen. Now we'll be assessing the vascular system, starting off with taking the radial pulse, just checking for rate and rhythm. Next, we'll be assessing the jugular vein to see if it's risen, and we'll be doing this by positioning the patient's head in a 45-degree angle, checking both sides. And lastly, we're going to be checking the carotid pulse for rate and rhythm as well. And finally, we're examining blood pressure, SpO2, heart, and lung sounds. Blood pressure, we just want to keep in mind any medications the patient may be on, any past medical history that may be important, and any family history that we would have taken during the systems review. Now we're going to be palpating for the second intercostal space to the right of the sternal border, looking for the aortic valve and just listening for any abnormalities. Next, we're going to be palpating the second intercostal space to the left of the sternal border. We're looking for the pulmonary valve now. Next, the tricuspid valve, which is located at the fourth intercostal space to the left of the sternal border. And lastly, for the bicuspid valve or the apex of the heart, we'll be palpating for the fifth intercostal space at the midclavicular line. want to perform thorough examinations on every single cardiac patient. However, specific things to look out for with right-sided heart failure would be things like descended jugular veins, dependent edema, weight gain from that edema, increased peripheral venous pressure, ascites, fatigue, enlarged liver and spleen, GI distress, and any secondary pulmonary problems that come with right-sided heart failure, since we know that right-sided heart failure does affect the pulmonary system. Thank you so much for watching, and remember, let's always keep our patients happy.